A clinical portal is pretty much what it says in the words. It is a portal focused on clinical information. And we're all used to using portals in the consumer world like Google and Yahoo, which allow you to search for information across the entire World Wide Web and view it in a single place, kind of finding a needle in a haystack. A clinical portal does exactly that, but around patient data, because the average hospital has over 100 different systems from which information about a patient could be derived. We put that in one place, just like Google puts the World Wide Web in one place. Carefx manufactures and distributes a clinical portal product to over 800 hospitals now around the globe.
The reasons we wanted to use a clinical portal was to be able to use the existing technology, the technology and applications that the clinicians are already familiar with, but bring that information through into one place for the clinician, allowing the flexibility of working, the speed of working, and also the fact that the information will be in real time and available to the clinician.
Clinical portals are necessary because patient information is distributed across multiple systems in a hospital. A typical secondary care hospital, acute hospital, has over 100 different clinical systems that information on a patient can be distributed across. So there's no one single place that any doctor or nurse can go to get all of the information about a particular patient. They have to access multiple different systems to get there, which is hugely inefficient and can have very negative impacts on patient safety and patient care.
The benefits to the clinician will be that they are able to look at the information about one patient in one place. They'll be able to not have to open multiple applications in order to find the patient information. There's flexibility and there's speed of use. From a patient safety perspective, the clinical portal will ensure that all the information for a patient is available to the clinician, which means they won't miss out any vital information by not opening a particular application.
The key benefits of clinical portals are that they pull information together from multiple different systems that otherwise a clinician would have to physically log into and physically navigate to. So we can take 75–80% of the navigation time away from the clinician so they can spend more time making decisions and spend time with the patients. A good example of that would be at Royal Liverpool, where they've been running a clinical portal in their outpatient clinics, and they're seeing a 40–50% increase in the throughput of patients that they can see in a clinic and actually finishing earlier. And that means they can spend more time actually providing care to the patients rather than navigating systems and running around doing administration tasks.
I think the key to success for the implementation of the portal was the clinical involvement. The clinicians were involved right from the beginning in designing what the portal was going to look like, what information was going to be brought across, and that makes the biggest difference.
The role of clinical portals in the future of healthcare organisations will be to spread wider, will be to bring in other parts of the care continuum. Healthcare is one piece of that, the GP is another, bringing in those social services, local authorities, mental health trusts and so on. So as there is one place, whether you're a social worker, a GP or a consultant in a hospital, one place to go to find out everything that you need to about that patient. The key shift going forward will be bringing the patient into that loop. And just the same way they can today do banking online, they can buy books online, they can do auctions online, why can't they take their own glucose readings, book their own appointments, order repeat medications, communicate via instant messaging or networking with a consultant? That is going to be the big shift that we see over the next 5 to 10 years.
The future strategy for the clinical portal for the Trust is to incorporate more of the applications that have clinical information, to move towards a paperless electronic patient record in its totality, to move towards mobile working, bringing the information closer to the patient's bedside and also out into the wider community.